Welcome back to Key Safety Talks, everyone. Today we're diving into something a little different.
A bit more insidious, you might say.
Okay, I like that. Insidious.
Yeah, we're talking about biological hazards.
Biological hazards. The
Damn.
unseen dangers, right? Those
Yeah.
things we don't always think about. The kind of stuff that, well, it can really mess you up.
Exactly. And they can have a whole range of effects, you know? It's not just a sniffle.
Right, not just a sniffle.
We're talking everything from allergies to infections that can knock you down, even poisoning, some that can be, well, fatal.
Yeah, the serious stuff. And it's easy to think, oh, that's for other people, not me. But honestly, these hazards are more common than we think.
They really are, lurking everywhere. Of course, some folks are more at risk.
Okay, like who? Who should be extra careful?
Think about people working in healthcare or agriculture. Lab researchers, too, they're dealing with this stuff all the time.
Right, dealing with things that could make them sick. So let's break it down, shall we? When we say biological hazards, what exactly are we talking about? What are the usual suspects?
Well, first up, you got your bacteria.
Bacteria, okay. Like the things that give you strep throat or food poisoning.
Those are some common ones, yeah. But there's also anthrax, which can be pretty nasty if you don't catch it in time.
Anthrax. Isn't that something you get from livestock?
It is, so farmers need to be careful. But it's also been used as a weapon, which is a whole other level of scary.
Okay, so bacteria, check. What else is lurking in the microscopic world?
Well, even smaller than bacteria, you have viruses. And these guys, they're sneaky. They actually need to get inside your cells to do their thing.
Like little hijackers taking over your body.
That's a good way to put it. And think about all the things they cause. Colds, the flu, hepatitis, rabies, the list goes on.
And some of those can be deadly, right? Like Ebola. That outbreak a few years back, that was terrifying.
Absolutely. And it shows how important it is to be ready for anything, you know, to be able to track these things and jump on them quickly.
Global surveillance, that's what they call it, right?
Exactly. Okay, so we got bacteria, viruses.
Yeah.
What else is out there?
Hit me with it. What other microscopic monsters are waiting to pounce?
Well, we also have fungi. A bit more complex than bacteria or viruses. Think of them like tiny plants almost. And they spread through spores.
Spores, so like mold, mildew, mushrooms, that kind of thing.
Exactly. And some are actually good for us. Yeast for bread, penicillin for infections.
Okay, good fungi, bad fungi.
Right. But some can cause nasty infections, especially if your immune system isn't the strongest.
And those infections, they can be hard to treat.
They can be, yeah. And tricky to diagnose sometimes, too. The symptoms can look like other things, so it's important to be aware of the risks, you know? And if you think something's off, get it checked out.
Get it checked out, good advice. Okay, bacteria, viruses, fungi, are we done yet?
Not quite. We've also got toxins.
Toxins, okay, so like venom from snakes, spiders, that sort of thing.
That's right. But toxins can also come from plants, you know? Poison ivy, some types of mushrooms. Even bacteria and fungi can produce toxins as a defense mechanism.
It's like a microscopic arms race out there. So it reminds me of that time a few years back when there was a recall on spinach because of some bacteria, right?
Yeah.
Some nasty toxin.
Good example. Foodborne toxins, they can be a real problem. That's why we have all those food safety rules.
Makes sense. Keep things clean, cook things thoroughly, and avoid those venomous critters if you can. I know snake bites are a big issue in some parts of the world.
They can be, yeah. And it's not just snakes. Spiders, scorpions, jellyfish, all sorts of creatures packing a nasty punch.
Right, a good reminder to be aware of your surroundings, especially when you're out in nature.
Yeah.
Okay, so toxins, got it. Anything else trying to take us down?
One more category, protozoa.
Protozoa. Hold on, remind me. What are those again?
They're single-celled organisms, but some of them are parasitic. That means they live off of a host, like us, and cause problems.
Ah, so like malaria, that's a protozoa, right? Spread by mosquitoes?
Exactly. Malaria is a big one, especially in tropical areas. And there are others that can cause all sorts of nasty stuff, from stomach problems to serious infections.
So it seems like these biological hazards are everywhere. Kind of makes you want to stay inside forever, wrapped in bubble wrap.
Well, it's not about living in fear. It's about knowing your enemy, right? Understanding how these things spread and what you can do to stay safe.
Okay, so let's talk about that. How did these biological bad guys actually get into our systems?
Well, there are a few main ways. First, there's direct contact. Pretty straightforward, right?
So touching something contaminated or coming into contact with bodily fluids, I guess?
Exactly, and that's why hand washing is so important, especially in healthcare, where you're constantly exposed to all sorts of stuff.
Wait, hand washing, the first line of defense. What else? What other ways can these things get in?
Then you have indirect contact. That's where you touch something that's been contaminated, like a doorknob, a keyboard, even medical equipment.
So basically anything that someone else who's sick has touched.
Exactly. That's why it's important to clean and disinfect surfaces regularly.
Especially those high traffic areas. Okay, direct contact, indirect contact. What's next?
Then there's droplet transmission, which is how a lot of respiratory illnesses spread.
Okay, like when someone coughs or sneezes right in your face.
Well, it doesn't have to be that direct. Those little droplets of saliva and mucus, they can travel a few feet and land on surfaces too.
So that's why it's so important to cover your mouth when you cough or sneeze.
Yeah.
And to stay home when you're sick. Right. Don't spread those germs.
Exactly. And if you are sick, try to cough or sneeze into your elbow, not your hand.
Oh, yeah, the vampire cough. I've had that.
Yeah.
Stops the germs from getting on your hands. Smart. Okay, droplet transmission, got it. What about airborne transmission? Isn't that different?
It is. Airborne transmission is where those droplets or even smaller particles can hang out in the air for a long time and travel further.
Okay, so not just a quick splatter, but those things are actually floating around in the air.
Right, so think about measles or tuberculosis. Those can spread through the air, and in those cases, you need more than just basic precautions.
Like special masks or even those negative pressure rooms we talked about earlier.
Ex-
Okay, direct contact, indirect contact, droplet transmission, airborne transmission. Are we done yet?
Almost. There's also vector-borne transmission. That's where something living, like a mosquito or a tick, carries the pathogen and spreads it to you.
So like malaria again,
Right.
or Lyme disease from ticks.
Right. And preventing bites is key in those cases. Bug spray, long clothes, checking for ticks, those kinds of things.
Makes sense. Stay away from those little bloodsuckers if
Right.
you can. And finally, we have the foodborne transmission we touched on earlier. Eating or drinking something that's got a nasty bug in it.
Exactly. Like salmonella from undercooked chicken or norovirus, which sometimes shows up in shellfish. Food safety is crucial.
Okay, so it seems like these biological hazards are coming at us from all sides. It's a lot to think about, but I'm starting to understand how knowing how they spread is important. It's like knowing your enemy, so you can come up with a plan to defeat them.
I like that, knowing your enemy. And, it's not just about protecting yourself. It's about public health, too.
Right, like those measures they take to stop outbreaks. Contact tracing, quarantines, all that stuff.
Exactly, trying to break those chains of transmission. And it all starts with understanding the risks. And that's where risk assessment comes in.
Risk assessment, okay. So how do we figure out what's actually risky?
Well, it's a process, a way to look at what hazards might be present and how likely it is they'll cause problems.
So for biological hazards, you'd be looking at things like what specific germs could people be exposed to in this particular place?
Right. And then you look at how likely that exposure is and how bad it could be if someone actually got sick.
So like working in a hospital is probably riskier than working in an office when it comes to these biological hazards.
Exactly. And even within a hospital, the risk will be different depending on what you do and who you're interacting with.
Right. So a surgeon operating on someone with a contagious disease is at a much higher risk than, say, the person who answers the phone in the lobby.
Exactly. It's all about understanding the specific risks in a specific situation and then figuring out what to do about it.
Okay, so you've identified the risks. Now what? How do you actually control these biological hazards?
That's where we bring in something called the hierarchy of controls. It's a way to think about what's most effective for keeping people safe.
So like a ranking system for safety measures.
You got it. And at the very top, we have elimination.
Elimination. Okay, so just get rid of the hazard entirely? Sounds good to me.
Sounds good to me too, but that's not always possible, right?
Right, you can't just eliminate every germ in the world.
Exactly. But sometimes you can. Like if a piece of equipment is always getting contaminated, maybe you replace it with something easier to clean.
Okay, so eliminate if you can, but what if you can't?
Yeah.
What's next on the list?
Next, you have substitution. That's where you replace something hazardous with something safer.
So like using a less toxic cleaning product or switching to a different type of needle that's less likely to cause a needle stick injury?
Exactly. Finding safer ways to do things.
So substitution. Got it. What's next?
Next up are engineering controls. This is where you actually change the physical environment to reduce exposure.
Okay, like what? Give me some examples.
Well, think about ventilation systems. Especially in hospitals and labs, good ventilation is crucial for removing contaminated air.
Right, so those special filters and negative pressure rooms we talked about earlier, those would fall under engineering controls.
They would, and there are others. Isolation rooms, safety cabinets, sharps containers, even something as simple as a hand washing station. It's all about making the environment safer.
So engineering controls are about changing the physical space. What about administrative controls?
Administrative controls are more about policies, procedures, and training. It's about having rules in place and making sure people know how to follow them.
Okay, so like hand hygiene protocols, vaccination requirements, procedures for handling contaminated materials, that sort of thing.
You got it. And training programs, of course, to make sure everyone understands the risks and how to protect themselves.
So administrative controls are all about rules and education. And finally, at the bottom of the list, we have PPE.
Right. Personal protective equipment. Gloves, masks, gowns, respirators. The last line of defense, but really important when needed.
But it's the least effective, right? Because it relies on people actually wearing it correctly and consistently.
That's the downside. PPE is important, but it should always be used along with other control measures, not as a standalone solution.
It's like you don't just wear a seatbelt and then drive like a maniac, right?
Right.
You still need to follow the rules of the road.
Exactly. It's a layered approach. And speaking of layers, there's another system in place for managing these biological hazards, especially in labs.
Okay, what's that?
We call them biosafety levels. Basically, there are 4 levels, from the most basic to the most extreme, based on how dangerous the agent is.
So a biosafety level 1 lab would be handling pretty harmless stuff, while a biosafety level 4 lab would be dealing with, like, the super deadly end-of-the-world type pathogens.
You got it. And each level has specific requirements for the lab itself, the equipment, the procedures, and the training of the people working there. It's all about making sure the containment matches the risk.
So it's like a tiered system of protection, with each level building on the one before it.
Exactly. And it's all designed to keep both the lab workers and the surrounding community safe.
It's amazing how much goes into managing these hazards. It's a whole science in itself.
It really is a constantly evolving field as we learn more about these pathogens and how to control them.
Okay, so we've covered a lot of ground today. From bacteria to viruses to fungi to toxins, we've talked about a whole zoo of biological hazards. And we've even touched on those fascinating biosafety levels and how they help keep those really nasty bugs contained.
We have. And I think it's important to remember that these hazards, while they can be dangerous, are often manageable. With the right knowledge and precautions, we can protect ourselves and others.
Okay, so awareness is key. But sometimes, even with the best precautions, things can go wrong.
That's right, and that's where real-world examples come in. It's one thing to talk about these hazards in theory, but it's another to see how they've actually played out.
Exactly. So let's dive into some historical cases and outbreaks, those events that really show us the impact of these biological hazards.
Welcome back to Key Safety Talks, everyone. We were just talking about those real-world examples, those outbreaks and incidents that really show the impact of these biological hazards. It can be a little scary, to be honest.
It can, yeah. It makes you realize this isn't just theoretical stuff. These hazards are out there, and they can have serious consequences.
Absolutely. But I think it's important to remember that knowledge is power. The more we understand these hazards, the better equipped we are to protect ourselves.
I agree. So let's dig a little deeper, shall we? We talked about those broad categories of biological hazards: bacteria, viruses, fungi, toxins, and protozoa. But I'm curious to hear more about some specific examples within those categories, some of the real threats we need to be aware of.
Sure. Let's start with bacteria. One particularly nasty one is Brucella.
Brucella. Okay. What's that one all about?
It causes brucellosis, which mainly affects livestock, but humans can get it too.
Ah, so another one that farmers and ranchers need to be aware of.
Exactly. Anyone who works with livestock, really. Veterinarians, meat packers, they're all at risk. And brucellosis can be pretty rough. Often starts with flu-like symptoms, but it can get a lot worse.
Worse how? What kind of complications are we talking about?
Well, it can affect pretty much any organ in the body. Joint pain, back pain, heart problems, even neurological issues. And sometimes it can become chronic. You're stuck with it for years.
That doesn't sound fun at all. Definitely something you want to avoid.
For sure. Early detection and treatment are key. Speaking of which, another nasty bacterial infection is leptospirosis.
Leptospirosis. I think I've heard of that one. Doesn't that one spread through contaminated water?
It does, yeah. Often through contact with the urine of infected animals. Rodents, livestock, even dogs.
So anyone who works in wet environments, like farmers, sewer workers, even people who like to swim in lakes and rivers, they need to be careful.
Absolutely. And the symptoms can vary quite a bit. Some people have mild flu-like symptoms, while others experience severe complications.
Like what? Give us the worst case scenario.
Well, leptospirosis can lead to kidney or liver failure, meningitis, even respiratory distress.
Okay, that's pretty serious. I'm starting to see a pattern here. These bacteria are not messing around.
No, they're not. And let's not forget about tetanus. That's one that most people have heard of, even if they don't really understand what it is.
Tetanus, yeah. The rusty nail disease. That's what we always called it as kids.
That's a common misconception, actually. It's not the rust itself that causes tetanus, but the bacteria that often live on rusty metal.
Okay, so what's the real story with tetanus?
Well, the bacteria that causes tetanus, Clostridium tetani, it lives in soil, dust, manure, those kinds of places.
So pretty much everywhere.
Pretty much, and it enters the body through wounds, especially deep puncture wounds, like if you step on a rusty nail.
Ah, so that's where the rusty nail thing comes from.
Exactly. And once inside the body, the bacteria releases a toxin that affects the nervous system.
And that's what causes those muscle spasms.
Exactly. And those spasms can be incredibly strong, even strong enough to break bones. Tetanus is a serious illness, but thankfully it's preventable with a vaccine.
That's why it's so important to stay up to date on your shots.
Absolutely. Vaccines are one of the most effective ways to protect ourselves from these bacterial threats.
Okay, so we've covered some pretty nasty bacteria. What about viruses? What are some of the top contenders in that category?
Well, one that's been in the news a lot lately is the Zika virus.
Zika, yeah. That's the one that can cause birth defects, right?
It can, which is why it's particularly concerning for pregnant women.
I remember all the warnings about traveling to areas with Zika outbreaks. It was a big concern for a while.
It was, and it's still a threat in some parts of the world. The virus can also cause Guillain-Barré syndrome.
Guillain-Barré, what's that?
It's a rare neurological disorder that can lead to paralysis.
Okay, that's definitely something you want to avoid. So how do you protect yourself from Zika?
Well, since it's spread by mosquitoes, preventing mosquito bites is key. Insect repellent, long clothing, eliminating mosquito breeding grounds, all those things are important.
Okay, so stay away from mosquitoes, got it. But what about the common cold? It might not be as exotic as Zika, but it sure causes a lot of misery.
Oh, the common cold. That's a tough one. It's actually caused by a whole bunch of different viruses, mainly rhinoviruses, and it spreads like wildfire.
No wonder it seems like everyone's always sick during certain times of the year. So is there a cure for the common cold?
Unfortunately, no. The best we can do is treat the symptoms and wait it out. But there are things we can do to prevent spreading it.
Like washing our hands, covering our coughs and sneezes, staying home when we're sick, all that good stuff.
Exactly. Prevention is key with the common cold.
Okay, let's shift gears to fungi. One that's particularly concerning is cryptococcosis.
Cryptococcosis. Try saying that 5 times fast.
Mm.
So what is cryptococcosis and what causes it? It's a fungal infection, and it's caused by a fungus called Cryptococcus neoformans.
Okay, and where does this fungus hang out?
It's often found in soil that's contaminated with bird droppings. So people who work with birds, like poultry farmers or pigeon fanciers, they need to be careful.
Interesting. So it's not just the birds themselves, but their droppings that pose a risk.
That's right. And people with weakened immune systems are also more vulnerable to this infection.
And what kind of symptoms does it cause?
It can range from mild respiratory problems to severe meningitis.
Meningitis. That's an infection of the brain and spinal cord, right?
It is, and it can be life-threatening if it's not treated quickly.
Okay, so this is serious stuff. What are the warning signs? What should people be looking out for?
Well, if you experience symptoms like fever, headache, stiff neck, or confusion, especially if you've been around bird droppings, it's important to seek medical attention right away.
Good advice. Early detection is key with these fungal infections.
Absolutely. Okay, we've talked about bacteria, viruses, and fungi. Let's move on to toxins. One that comes to mind is botulism.
Botulism, isn't that the one you can get from improperly canned food?
Yes, that's a common source. The toxin that causes botulism is produced by a bacterium called Clostridium botulinum.
Clostridium botulinum, got it. So what does this toxin do? Why is it so dangerous?
It basically paralyzes muscles, and in severe cases, it can lead to respiratory failure.
So you can't breathe.
Exactly, it can be fatal.
Wow, that's scary. So what's the best way to avoid botulism?
Well, following safe canning practices is crucial. And always avoid eating any canned food that shows signs of spoilage.
Like bulging cans or a bad smell.
Exactly. Those are red flags. And it's worth noting that botulinum toxin is also used in small doses for cosmetic purposes. Botox injections.
Right, Botox. So that's the same toxin that can cause botulism.
It is. But obviously, the doses used in Botox are tiny, And it's important to get those injections from a qualified medical professional.
Okay, that makes sense. Don't try this at home, folks. Stick with the professionals. Okay, last but not least, let's talk about protozoa. What's a particularly nasty example in that category?
Well, one that causes a lot of suffering worldwide is Entamoeba histolytica.
Entamoeba histolytica. Say that 3 times fast.
Ah.
So what does this little critter do?
It causes amoebiasis.
Amoebiasis, okay. Another one for the vocabulary list. What is amoebiasis?
It's an infection of the intestines, and it can lead to dysentery.
Dysentery. That's a severe form of diarrhea, right? With blood and mucus.
That's right.
Sounds awful. How is it spread?
Through contaminated food or water. It's a big problem in areas with poor sanitation.
So travelers to developing countries need to be extra careful about what they eat and drink.
Absolutely. Practicing good hygiene is essential. Washing hands frequently, using bottled water, all those things can help reduce the risk.
It's amazing how these tiny organisms can cause so much trouble.
They might be small, but they can have a big impact. And that's why it's so important to be aware of them and take steps to protect ourselves.
Absolutely. So we've talked about the hazards, the risks, the ways these things spread. But now I want to circle back to something we mentioned earlier, risk assessment. How do we actually figure out the level of risk in a particular situation?
Good question. Let's say you're a safety manager at a hospital. How would you go about assessing the risk of biological hazards in that environment?
Okay, good example. A hospital. Lots of potential hazards there. So what's the first step? Where do you even begin?
The first step is to identify the hazards. What specific pathogens are workers likely to be exposed to? What are the tasks that involve contact with blood, body fluids, those kinds of things?
So you need to consider the different departments, the types of patients, the procedures being performed. It's a lot to think about.
It is, and you'd want to involve the experts. Talk to the doctors, the nurses, the infection control specialists, get a comprehensive picture of the potential risks.
Okay, so you've identified the hazards. What's next?
Then you need to assess the likelihood of exposure. How likely are those workers to actually come into contact with those pathogens? What are the routes of transmission? What control measures are already in place?
So things like hand hygiene practices, the use of PPE, isolation procedures, vaccination rates, all those things we've been talking about.
Exactly. And you'd also want to consider the worker's individual susceptibility. Are there any workers who are immunocompromised or have other health conditions that might make them more vulnerable?
Good point. So you've identified the hazards and assessed the likelihood of exposure. What's the next step in this risk assessment process?
Next, you evaluate the potential consequences of exposure. What are the health effects associated with those pathogens? How severe are they? Are there any long-term complications?
So something like hepatitis B would be a bigger concern than the common cold, for example.
Exactly. And you'd also want to consider the potential for secondary transmission. Could an infected worker spread the illness to other workers, patients, family members?
Okay, so you've identified the hazards, assessed the likelihood of exposure, and evaluated the potential consequences. What's the final step?
The final step is to determine the level of risk. You take all those factors into account and assign a risk rating low, medium, or high.
And that rating helps you decide what to do about it, what kind of control measures to put in place.
Exactly. If the risk is low, existing measures might be sufficient. But if it's medium or high, you'll need to do more.
So risk assessment is really about making informed decisions, figuring out where to focus your efforts.
It is. And it's an ongoing process. You need to revisit those assessments regularly. Things change, new hazards emerge, work practices evolve. You need to stay on top of it.
So it's not a one-time thing, it's a continuous cycle of evaluation and improvement.
Exactly. And that brings us to the next logical step, control measures. What can we actually do to reduce the risk of exposure and prevent these illnesses?
Okay, that's the million-dollar question, right? We know the risks. Now, how do we protect ourselves?
Well, we've already touched on the hierarchy of controls. But let's dig a little deeper into some specific control measures that are especially effective against these biological hazards.
Sounds good to me.
Yeah.
Let's start at the top of that hierarchy elimination.
Yeah.
What are some real-world examples of how we can actually eliminate these hazards?
Well, the best example is smallpox. Through a global vaccination campaign, smallpox was completely eradicated from the world.
That's incredible. A
Yeah.
disease that had plagued humanity for centuries, completely wiped out.
It's a remarkable achievement, and it shows what's possible when we work together. Now, obviously, we can't eliminate most biological hazards entirely, but there are situations where elimination is feasible.
Okay, like what? Give me an example.
Well, let's say you have a piece of equipment in a lab that's consistently contaminated with a particular bacteria. You might be able to eliminate that source of contamination by replacing that equipment with a newer, easier to clean model.
Okay, that makes sense. So elimination where possible. But what about substitution? How can we use that principle to control biological hazards?
One great example is the use of needleless injection systems in healthcare.
Needless injections. How does that work?
These systems use high pressure to deliver medications or vaccines through the skin without a needle.
So no needle stick injuries.
Exactly. And it's not just about protecting healthcare workers, it also reduces the risk of sharps injuries to patients and the general public.
Okay, that's a brilliant innovation. Safer for everyone.
Another example is the use of biological indicators in sterilization processes. Instead of using harsh chemicals, which can be hazardous to workers and the environment, these indicators use harmless bacterial spores to test whether a sterilization process is effective.
So you're substituting a potentially dangerous chemical with a safe biological alternative.
Exactly, it's a win-win. Okay, let's move down the hierarchy to engineering controls, those changes to the physical environment we talked about earlier.
So give us some examples of engineering controls that are specifically designed for biological hazards.
Well, one of the most common is the use of ventilation systems, especially in healthcare settings and laboratories.
Right. Those HEPA filters and negative pressure rooms we talked about earlier.
Yeah,
They would fall under engineering controls, right?
exactly. And there are others: isolation rooms, safety cabinets, sharps containers, even something as simple as a hand washing station.
Right. Making it easy and convenient for people to wash their hands. That can make a big difference.
It really can. Okay, so ventilation systems, isolation rooms, hand washing stations. What else? What are some other examples of engineering controls?
Let's see. We talked about those biological safety cabinets, right? Those enclosed workspaces with the HEPA filters.
Yes, those are crucial for protecting both the worker and the environment when handling potentially infectious materials.
Okay, so those would be considered engineering controls too.
Absolutely. And then there are simpler things, like sharps containers.
Right, those puncture-proof containers for disposing of needles and other sharp objects. Keeps those sharps out of the general trash
Mhm.
where they could injure someone.
Exactly. It's all about designing the environment to minimize risks.
Okay, so engineering controls are all about the physical space. What about administrative controls? What are some examples of those in action?
Well, one of the most important is the OSHA bloodborne pathogens standard.
Right, we talked about that earlier. The regulations that protect workers from exposure to bloodborne pathogens.
Exactly. That standard mandates things like training programs, vaccination for hepatitis B, the use of engineering and work practice controls, and the proper handling and disposal of contaminated materials. It's a comprehensive approach.
Okay, so the bloodborne pathogens standard would be considered an administrative control. What else? What are some other examples?
Well, there are things like infection control protocols in healthcare settings.
Right, all those procedures that healthcare workers follow to prevent the spread of infection.
Yeah.
Hand hygiene, PPE, isolation procedures, cleaning, and disinfection.
Exactly. It's a system designed to keep everyone safe: patients, visitors, and healthcare workers.
Okay, so infection control protocols, another example of administrative controls. What else?
Well, there are also things like travel advisories and vaccination recommendations.
Right, those warnings about traveling to areas with outbreaks of certain diseases.
Exactly. And recommendations for getting vaccinated against those diseases if you do travel to those areas.
Okay, so those would be administrative controls too. It's
Yeah.
all about providing information and guidance to help people make informed decisions.
Absolutely. And then, of course, we have our last line of defense: personal protective equipment, or PPE.
Right, gloves, masks, gowns, all that good stuff.
Exactly. And it's important to remember that PPE is most effective when it's used in conjunction with other control measures.
Right, it's not a substitute for following proper procedures.
Absolutely.
Yeah.
So let's talk about some specific types of PPE that are commonly used to protect against biological hazards.
Okay, break it down for us. What are the essentials?
Well, gloves are one of the most basic and important pieces of PPE. They protect the hands from contact with blood, body fluids, all those potentially infectious materials.
Right, and there are different types of gloves for different situations, right?
Exactly. Some are single-use, while others can be disinfected and reused. The choice depends on the task and the level of risk involved.
Okay, so gloves, check. What about masks?
Masks are essential for protecting the respiratory system from airborne pathogens.
Right. And there are those simple surgical masks, and then there are those more heavy-duty N95 respirators.
Exactly. And again, the type of mask needed depends on the pathogen and the risk of transmission.
Okay, gloves, masks, what else?
Gowns. Gowns are worn to protect the body from splashes or sprays of potentially infectious materials.
Right, and those can be single-use or reusable too, depending on the situation.
Exactly. And then there's eye protection.
Oh, right, goggles or face shields.
Exactly. To protect the eyes from splashes or sprays.
Okay, so PPE is really about creating a barrier between the worker and the hazard.
That's the basic idea. And it's an important part of any comprehensive safety program for biological hazards.
Okay, so we've talked about the hazards themselves, the different routes of transmission, the hierarchy of controls, and all those specific control measures. It's a lot to take in, but I think it's starting to make sense. It's like a puzzle, and all those pieces are starting to fit together.
That's a good way to think about it, but there's one more piece to the puzzle that we need to talk about.
Like, what's that?
The human factor.
A human factor, right. We can have all the best equipment and procedures in the world, but if people don't follow them, it's all for nothing.
Exactly. People are often the weakest link in the chain.
So how do we address that? How do we make sure people are actually following the rules?
Well, training is essential. Workers need to understand the hazards, the risks, and the proper procedures for protecting themselves.
But it can't just be a boring lecture, right? It needs to be engaging and relevant.
Absolutely. Hands-on training, interactive activities, real-world examples, all those things can make a difference.
And the training needs to be ongoing, right? Not just a one-time thing.
Exactly. Regular refreshers are important to keep those safety messages top of mind.
Okay, so training is crucial. But what about motivation? Why should people care about following these safety procedures? What's in it for them?
Well, for starters, it's about protecting themselves. Nobody wants to get sick.
Right, and nobody wants to bring those illnesses home to their families.
Exactly. It's about protecting their loved ones, too.
And it's about protecting their coworkers and the public in general.
Absolutely. It's about being a responsible member of the community. And then there's the legal and ethical responsibility. Employers have a legal obligation to provide a safe workplace, and workers have a responsibility to follow those safety procedures.
Right, it's a two-way street.
Exactly. Safety is a shared responsibility.
So it's about creating a culture of safety, where everyone feels empowered to speak up, ask questions, look out for each other.
That's a great way to put it. It's about making safety a priority, not just an afterthought.
And it's about recognizing that safety is a journey, not a destination. We're always learning, always improving.
I like that. A journey, not a destination.
Okay, so we've covered a lot of ground today. We've explored the world of biological hazards from every angle. We've talked about the science, the risks, the control measures, and the importance of the human factor. It's been an intense journey, but I think it's been a worthwhile one.
I agree. It's important to have these conversations, to raise awareness, and to equip people with the knowledge they need to protect themselves.
Absolutely. And I think our listeners are getting a crash course in all things biohazards today. But before we sign off for today, I want to leave our listeners with one final thought.
Okay, I'm all ears.
We've talked about all the things we can do to prevent exposure to these hazards, but what happens if, despite our best efforts, someone does get sick? What then?
That's a great question, and it brings us to the important topic of post-exposure management. What do you do after you've been exposed to a biological hazard? What are the steps involved?
Welcome back to Key Safety Talks, everyone. We've been digging deep into this world of biological hazards, talking about everything from those microscopic bacteria to those complex viruses.
It's a fascinating area, but I think it often gets overlooked in those general safety conversations. People focus on the more obvious stuff.
That's true. Out of sight, out of mind, as they say.
Yeah.
But in this last part, I want to focus on something specific.
Okay, what's that?
Labs. The places where these biological agents are studied, researched, even manipulated sometimes.
Right, the stakes are higher there, for sure.
Exactly. So let's talk about biosafety in labs. How do we keep those lab workers safe, and how do we protect the community outside those labs?
Good question. It all starts with containment. That's really the foundation of everything when it comes to lab safety and biological hazards.
Okay, containment. What does that actually mean? What does it look like?
It's a multi-layered approach, honestly. It starts with the people, how they work, and it goes all the way to how the lab itself is designed and built.
So it's not just about wearing a lab coat and gloves.
No, it's much more than that. Training is huge. Everyone working in a lab with biological agents, they need to be trained properly, know the procedures inside and out.
So we're talking about wearing the right PPE, cleaning those work surfaces, being super careful with needles.
All of that, absolutely. No cutting corners when it comes to biosafety. And those procedures, they need to be written down, reviewed regularly, and everyone needs to follow them to the letter. No exceptions.
Those procedures would be different depending on what they're working with, right? A common bacteria versus something really dangerous.
Of course, you wouldn't handle a highly contagious virus the same way you handle a harmless bacteria. Different levels of risk require different levels of precaution.
Makes sense. But procedures alone can't contain everything. What about the lab itself, the physical space?
Right, that's where the design of the facility comes in. Those labs that work with higher risk agents, they're built differently, designed to keep those agents from escaping.
Okay, give us some examples. What kind of design features are we talking about?
Well, one big one is access. You can't just wander into a high containment lab. They have strict rules about who can go in and out, often multiple layers of security.
So you're minimizing the number of people who could be exposed and making sure anyone who does go in is prepared.
Exactly. And within the lab itself, there are specific work areas, sometimes separated by barriers, even in different rooms, depending on the risk level.
So you're reducing the chances of something spreading from one experiment to another, cross-contamination.
Right. And all those surfaces in the lab, they need to be easy to decontaminate. They use materials that can handle those strong disinfectants.
Okay, easy to clean, makes sense. And ventilation's got to be important too, right? Making sure contaminated air doesn't get out.
Absolutely crucial. They use specialized ventilation systems, often with those HEPA filters we talked about before.
HEPA filters, right. Those are the ones that trap those tiny particles. I've been thinking about getting one for my house, actually.
They can definitely help with air quality. In labs, they're often part of a system that creates what we call negative pressure.
Negative pressure. Okay, remind me what that is again.
It means the air pressure inside the lab is lower than the pressure outside.
So if there's a leak or a crack, air flows in, not out. It's like sucking those contaminants back into the lab.
Exactly, like an invisible force field keeping everything contained.
That's pretty cool.
Yeah.
Okay, so we've got limited access, those designated work areas, easy to clean surfaces, and those specialized ventilation systems. What else helps with containment in a lab?
Well, there's also the equipment, things that create a physical barrier between the worker and the biological agent.
Like those biological safety cabinets, right? Those things always look so serious in movies.
They are. They're basically enclosed workspaces with those HEPA-filtered airflows designed to keep the worker safe and prevent those agents from getting out.
So anything risky is handled inside that cabinet.
Exactly. And there are different types of cabinets, different levels of protection depending on what you're working with.
Okay, break it down for us. What are those different types?
The most basic type is a Class I cabinet. It protects the worker and the environment, but it doesn't create a sterile work area.
So it's for those procedures where sterility isn't critical,
Right.
but you still need to contain potential contaminants.
Exactly. Then you have Class II cabinets. They have that HEPA-filtered downward airflow, which keeps the work surface clean, good for things like cell cultures or drug preparations.
So a little more protection for those more sensitive tasks.
Right. And there are actually a few types within Class II, each with slightly different airflows and uses.
So you pick the right cabinet for the job. Makes sense. What about the most extreme stuff? What do they use for that?
That's where Class III cabinets come in, maximum containment. They're completely sealed, gas-tight, and all the work is done through glove ports.
Wow, so you're basically working inside a mini biohazard suit.
Pretty much. And those Class III cabinets, they have their own dedicated ventilation systems and decontamination procedures. Super high security.
It's amazing how much thought goes into all of this.
Yeah.
All those layers of protection.
It's essential. It shows how seriously we take those risks when working with biological hazards in the lab. But it's not just about the physical stuff. Remember those biosafety levels we talked about earlier?
Right, those 4 levels of containment. How do they fit into all of this?
Those levels determine what practices, what equipment, and what facility design features are required for a specific lab.
So a biosafety level 1 lab, the basic level, would have less stringent requirements than a level 4 lab, which would have the most extreme safety measures.
Exactly. It's a tiered system, matching the containment to the risk.
It's all about minimizing the risk of exposure and keeping people safe. both inside and outside the lab.
Absolutely. And don't forget that OSHA bloodborne pathogen standard we talked about earlier, that plays a big role in lab safety too.
Right, the rules about protecting workers from bloodborne pathogens, which are a major concern in many labs.
Exactly. It covers everything from training to vaccination to those engineering and work practice controls, even the proper way to handle and dispose of those contaminated materials.
It's a pretty comprehensive set of regulations, all designed to make sure those labs are as safe as possible.
It is, and I think it highlights something really important. Even though we can't eliminate all these hazards, we can do a lot to reduce the risks.
By understanding the hazards, taking precautions, and advocating for safe work practices.
Exactly. It's about being proactive, not just waiting for something bad to happen. It's about creating a culture of safety where everyone's involved.
That's a great point. It's not just the responsibility of the safety manager or the lab supervisor. It's everyone's responsibility.
Right. We all have a role to play in keeping each other safe.
Okay, I think we've covered a lot of ground today. We've gone from those tiny microbes to those high-tech labs, exploring all those different aspects of biological hazards. It's been quite a journey.
It has, but I hope it's been an informative one.
I think it has. And I hope our listeners are walking away feeling empowered, not scared.
Exactly. Knowledge is power. And with the right knowledge, we can make informed choices and stay safe.
And remember, this is just the beginning. There's always more to learn. We encourage you to keep asking questions, keep learning, and keep advocating for safer workplaces. Safety is an ongoing process, and we're all in this together. Thanks for joining us on Cree Safety Talks. Until next time, stay safe and stay curious.